Hello everyone, my name is Mel Calvert and I'm Professor of Outcomes Methodology at the University of Birmingham in the UK and Director of the Centre for Patient Reported Outcomes Research. I'm delighted to be co-chairing this session with my good friend and colleague, Professor Michael Brundage.
Hi folks, I'm Mike Brundage and I'm a radiation oncologist and professor in oncology at Queen's University Cancer Research Institute in Kingston, Ontario, Canada. Thank you for your interest in the Proteus Consortium. The consortium aims to optimize the use of patient-reported outcomes to ensure that the patient's perspective is effectively captured and can be used to inform research and practice. In this presentation, we focus on guidance for the optimal reporting of findings from clinical trials. Proteus was initially funded by the Patient-Centered Outcomes Research Institute and has continuing funding from Genentech. Proteus stands for Patient-Reported Outcome Tools, engaging users and stakeholders. The materials that we'll present today, as well as other resources of the consortium, can be found on our website shown at the bottom of this page, theproteusconsortium.org. This presentation is one in a series about Proteus and the tools and resources available to optimize the use of PROs in clinical trials. We aim to achieve this optimization by promoting best practices across the continuum of the clinical trials lifecycle as shown here. So on the left, guidance in developing proper clinical trials protocols with respect to the PROs, selecting measures appropriately, analyzing data appropriately, reporting the data appropriately, displaying the data appropriately, and making the interface with clinicians as easy as possible. This presentation is an overview of the tool recommendations for reporting PRO findings from clinical trials as shown in the yellow highlighted district of this slide. We have additional presentations that are more detailed in how to apply each of these tools across the spectrum shown here. In this presentation, the focus is on standards for PRO reporting guidance, but displaying the PRO data is also a component of best reporting practices and is summarized in a companion presentation. We developed the CONSORT Pro guidance to promote clearly described pro findings in clinical trials publications, and as such, the CONSORT PRO guidance is used along with the main CONSORT recommendations for clinical trial reporting. Guidance was published in JAMA in 2013, as shown here. And on this slide, we gratefully acknowledge the other members of the project team, as well as our collaborators and our funders over the years. Now back to you, Dr. Calvert.
So why do we need patient-reported outcome reporting guidance? Well, we know that clinicians, patients, and policymakers really value patient-reported outcome information. But sadly, existing reporting guidelines are not adhered to. Poor reporting hampers the use of patient-reported outcome data in clinical practice and undermines the clinician's ability to use these data in their practice to benefit patient care. Improved reporting of PRO data should facilitate robust interpretation of the results from RCTs and inform patient care. The objective of the resource is to use the CONSORT guidance to improve the reporting of randomized controlled trials. Now, CONSORT statement lacks guidance on the reporting of PROs specifically. So the aim of the CONSORT Pro extension was to provide an evidence-based extension of the CONSORT statement for reporting PROs in randomized clinical trials. We've called these extensions, and also to elaborate on the CONSORT 2010 statement specifically as applied to PROs, and these are called elaboration statements. Now I'd like to provide you with an overview of the CONSORT Pro reporting guidance. This is to be used in conjunction with the CONSORT 2010 statement and related extensions as appropriate for the trial design. It comprises 5 additional checklist items, extensions, recommended to be reported in all RCTs where PROs are a primary or important secondary outcome. It also provides additional elaborations on the existing CONSORT 2010 checklist items as applied to the reporting of PROs in RCTs. The first Pro extension relates to the abstract, item 1B. In CONSORT 2010, is stated that structured summary of the trial design, methods and results and conclusions should be stated in the abstract. The pro extension states that the PRO should be identified in the abstract as a primary or secondary outcome. This will facilitate indexing and identification of studies to inform clinical care and evidence synthesis. The second pro extension, introduction item 2B, was specified in CONSORT 2010 as specific objectives or hypotheses should be stated in the introduction. The pro extension states that the PRO hypothesis should be stated and relevant domains identified if applicable. The reason for this is that without a pre-specified hypothesis, there is a real risk of multiple statistical testing and selective reporting of significant results. Pro extension item 6A relates to the methods. In CONSORT 2010, it stated that completely defined pre-specified primary and secondary outcome measures should be specified, including how and when they were assessed. The pro extension states that evidence of pro-instrument validity and reliability should be provided or cited if available. And the reason for this is that the clinical use of PRO data requires that the trial results are robust, which depends on a valid and reliable PRO being used appropriately. Pro extension methods item 12A, in CONSORT 2010, it stated that statistical methods used to compare groups of primary and secondary outcomes should be specified. And the pro extension detailed that statistical approaches for dealing with missing data should be explicitly stated. Now, this is important because the level of missing PRO data is often high, and this can lead to a reduced power and is a potential source of bias. This can lead to misleading trial results. And the final pro extension item relates to the discussion. This is item 20 and 21. And so in CONSORT 2010, the item 20 statement stated that the trial limitations should address any sources of potential bias, imprecision, and if relevant, multiplicity of analyses. And then related to that, the CONSORT 2010 statement, item 21, stated that generalizability, including external validity and applicability of the trial findings, should be discussed. The pro extension states that pro-specific limitations and implications for generalizability of study findings and clinical practice should be described. Readers really need to know and be able to assess the generalizability and any potential sources arising for the PRO data within the trial. I'll now hand back over to Michael to discuss the PRO elaborations.
Thank you. The elaborations, as Dr. Calvert mentioned earlier, are slightly different than the extensions in that they basically elaborate on the 2010 statement rather than extend it with new details explicitly. We'll show you what you mean in the following examples. The first elaboration to discuss is one in the introduction, item 2A. The CONSORT statement includes that scientific background and explanation of the rationale for the RCT as a whole should be reviewed. That includes, as shown in the middle here, why PROs were assessed in the RCT, and this should be briefly described in order that the reader can put the PRO findings and the PRO objectives in the context of the other trial outcomes. In terms of the methods, item 6A, the CONSORT 2010 statement says that completely defined pre-specified primary and secondary outcome measures were assessed, as we mentioned earlier. The extension on this is that the details of the mode of pro-completion, for example, proxy completed questionnaires, and the method of data collection should also ideally be provided, particularly if the pro is a primary study outcome. The reason for this elaboration is because different methods of data collection may affect the results and lead to potential bias if used differentially between the intervention groups. The third elaboration is results item 13A. Again, the CONSORT statement makes it clear that for each group, the number of participants who were randomly assigned and received the intended treatment are clearly articulated. For PROS, the number of participants reporting PRO data at baseline and at subsequent time points should be made transparent. This allows the reader to interpret the amount of missing PRO data and therefore help the reader interpret the potential for bias owing to missing data. Also in results, the CONSORT 2010 statements suggests a table showing baseline demographic and clinical characteristics, the typical table 1 for a study report. This should include the baseline PRO data when collected, as this will allow clinicians and policymakers to assess the relevance of the PRO data and the generalizability of the trial findings given the PRO scores in the trial study population. Further, with respect to results, the CONSORT 2010 statement suggests that for each primary and secondary outcome, the results for each group and the estimated effect size and its precision should be reported. This is clearly also true for multidimensional PROs, where results for each domain and time points should be articulated in the same way. This is because the potential for selective PROs is increased when study measures contain multiple scales and items, as was discussed earlier. In general, all the PRO results should be presented alongside other outcome data to facilitate the clinical integration of the PRO findings with the other trial outcomes. Finally, with respect to the discussion, PRO data should be interpreted in relation to the other clinical trials outcomes, including survival data where relevant. This can be particularly true when the results are at odds with one another in the sense that a study intervention could improve survival, but could have unwanted effects on patient-reported outcomes. The interpretation of the authors in analyzing and integrating these findings into clinical practice is crucial in the reporting of the study. Finally, we'll discuss the implications. Back to you, Dr. Kelly.
Thank you. So it's really important that we consider the implications of using CONSORT Pro, and improved PRO reporting in clinical trials will enable robust evidence to inform patient choice, aid clinical decision-making, and inform health policy. And we would really encourage active implementation by yourselves, by journal editors, authors and reviewers to improve the reporting of these important data. PRO reporting is intrinsically linked to study design, and we'd recommend that you consider design in relation to FDA guidance and also the SPIRIT initiative, which is featured elsewhere within the Proteus series. By way of a recap, the final CONSORT Pro guidance identifies 5 items to be reported in all RCTs in which PROs are a primary or important secondary outcome. An extension was deemed unnecessary for a number of existing CONSORT checklist items. However, an elaboration of these items in the context of PROs are recommended. It is recommended that the CONSORT Pro guidance supplements the standard CONSORT guidelines for reporting RCTs with PROs as primary or secondary outcomes. Here we provide a list of further reading that may be of interest to you. Thank you very much for your time today, and we encourage you to look at other relevant guidance within the Proteus toolkit. Thank you.